Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Wayne Dysinger. Dr. Dysinger is an international leader in the field of lifestyle medicine and has served as the chair and founder of the American Board of Lifestyle Medicine. He has also been the chair of preventive medicine at the Loma Linda Medical Center for a dozen years or so he was. And he's got his own program called Lifestyle Medical, which we'll talk more and more about. Welcome, Dr. Dysinger. It's a pleasure to have you here. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Great to be here. Looking forward to our conversation.
Yeah, I noticed in going back into your bio, it's kind of interesting because you're one of the few people that grew up in the belly of the Blue Zone in Loma Linda. So I find that really kind of an intriguing thing. I'm imagining that your background is Seventh-day Adventist. Is that correct?
It is. Yeah. I was,
and my my ex-wife was raised in a family of Seventh-day Adventists, so I had a lot of connection with those relatives. Early on in your life, did your family embrace those principles, like the Ellen White principles in terms of lifestyle, nutrition? Were they very much a part of that in terms of your growing up? Give us a little idea of your background and how it led you to where you are.
Yeah, I was raised a Seventh-day Adventist. I was raised in sort of a conservative branch of Adventism. I was raised vegetarian, so I've never had meat as part of my diet.
Right.
I was not raised vegan, so and I'm not sure how healthy the food was that I was raised with, because back then we didn't talk about processed foods and we didn't talk about some of those kinds of things. But it's always been I've always had a plant-based diet.
That's from your early year, and it's kind of intriguing because in being with different groups of Adventists through my life. I've been with very conservative groups. When I first went into practice in upstate New York, there was a commune of people that were Adventists, and they were practicing the real original, like Ellen G. White, a program from the 19th century. But my family members, my wife's relatives, they had, some refined sugar and some dairy products, no meat. It was vegetarian, as you described. So they were much more in that vein of practice. So this was you through your early years. And so obviously you had an interest. And then what was the drive for you in terms of what was the stimulus to go into medical education? Give us a little background of how that transpired. I know you went to Loma Linda eventually, but give us a little bit of your early life and the influences that drove you to want to do what you do.
Yeah, so I was born in Loma Linda and raised largely in Loma Linda. My dad's a physician, so that's where my interest in medicine started. And I always had an interest in sort of the preventive medicine side. The whole lifestyle medicine piece came on later. That's maybe a different story. But I think the path to medicine and the path to sort of being in a healthy space in medicine, not being, a intensivist or some other kind of thing, that was there just from the family I was raised in, I believe.
Wayne, early on, you had that interest in preventive medicine, but as you and I know, when you get into medical training, and I don't know if this is consistent at Loma Linda, that's not really part of the curriculum. It's not really about preventive medicine. It's a lot more about kind of being a disease manager and learning how to manage symptoms and so on, and not necessarily taking that role of really teaching people how to prevent and change some of these major health issues. So how did you deal with that? Was that a problem for you? Were there any difficulties in making that adjustment, realizing that as much as you had that interest, that's kind of not the way the educational part was going to go, at least initially.
Yeah, that's a good question. And I was at Loma Linda, and Loma Linda does have a reputation for sort of preventive medicine, lifestyle medicine kinds of things. But I think probably what drove me was the fact that I just had this really strong interest in preventive medicine. And even though I wasn't getting a lot of that in my curriculum, I was getting some of it. And I was in an atmosphere. So I actually started taking classes at the School of Public Health at Loma Linda while I was in medical school, because I had that much of an interest, and I was pursuing it at that level. So when I got into the hospital and I was rotating through ICUs and things like that, that was discouraging to me. But I do feel like there was enough around, and my passion was strong enough that I could primarily go the direction that passion was taking me.
Well, so I know that you have a master's in public health. So did you get that before the MD, or was that after your MD training?
I did a few classes during medical school, and then I finished up my classes in residency. Actually, I specifically looked for a residency where I could take further classes in public health.
Well, full circle, you wound up ending up being the chairman of the preventive medicine department at Loma Linda Medical Center, which is kind of intriguing. So talk about how that whole thing evolved for you.
So I did a family medicine residency, and then I did a preventive medicine residency. And then I got into academia. And so I did that some back in Atlanta. I did it some up at Dartmouth in New England. As I was developing that, basically Loma Linda heard about what was going on there, and then they recruited me back. And it was actually a dream job for me to be the chair of preventive medicine at Loma Linda. So I came back there in 2003, so 20 years ago now.
Well, I'm assuming that when you had that position, you were playing a major role in helping to educate physicians in the direction of preventive medicine, which probably was very rewarding for you because, as you know, so much of that doesn't exist in typical medical education. So for someone to be able to make that kind of contribution, I think that's fantastic. So that must have felt really good and rewarding for you.
It was. We were able to insert preventive medicine and lifestyle medicine into all 4 years of the curriculum at Loma Linda, which was very gratifying.
Wow. So we're going to take just this. I'm here with Dr. Wayne Dysinger. We're going to take just a short break to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here, encouraging you to check out the NHA membership. For just $35 a year in the U.S. and $55 internationally, you'll have access to a wealth of resources, including our quarterly full-color print magazine, Health Science. Stay updated on the latest health tools, inspiring stories, and exclusive events like the NHA Conference and plant-exclusive cruises. Join us at healthscience.org/membership and make a difference in your life and the world. I'm Dr. Frank Sabatino, your host, and now back to the NHA Health Science Podcast, where more exciting insights await you. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Dr. Wayne Dysinger today, who's an international leader in the field of lifestyle medicine. And it stated that you were involved actually in establishing, founding the board of the American Board of Lifestyle Medicine. So that's kind of a big step. And I know now, of course, there's been such a mushrooming of so many physicians that are embracing lifestyle medicine. So that in itself must be another beautiful step in your career to be connected to that in that way.
Yeah, so the story behind that is shortly after I came back to Loma Linda, one of my colleagues, one of the people that was in the preventive medicine department, his name is John Kelly. He started the American College of Lifestyle Medicine. So I had the privilege of being there on day one as the field of lifestyle medicine, as started by John Kelly, began. And I was the third president of the American College of Lifestyle Medicine. So it's been something I've been around. And what we were noticing in those early days is that there was a lot of question around lifestyle medicine, and there was people out there starting to claim that they were lifestyle medicine specialists, but they weren't really doing what the lifestyle medicine movement wanted them to be doing. So we felt like a board would be really important to differentiate sort of the people that weren't scientific and evidence-based and the people
Right.
that were scientific and evidence-based. We also thought it would help us gain recognition with like the American Medical Association or the Accreditation Council for Graduate Medication, some of these other larger organizations that are influential in medicine. And we always felt like lifestyle medicine had this ongoing place in the bigger picture of how we do medical care.
Yeah, so let's talk about the lifestyle medicine movement just a little bit. And in the process of doing this, I'd like to get the audience to understand your vision and philosophy of the idea of not only prevention but reversibility. And this is a big piece because, as you and I know, while we talk about prevention and we know that certain things that people can do will help prevent certain negative outcomes in terms of disease, but the idea that you can take very sophisticated chronic diseases and through these lifestyle interventions be able to really reverse major conditions of diabetes and heart disease and so on, I think it's worth continually being able to mention that because I think for many people, they have this mentality that, yeah, if I do this, I can prevent this problem. But surely if I have this problem, I have to do some other yeoman interventional medical approach. And these same lifestyle factors may not give me the kind of reversibility that I want. So why don't you share what the lifestyle medicine approach is really trying to do and how you fit into that with your vision on this idea of prevention and reversibility. I think it'll be enlightening for the audience.
Yeah, so it's nice to start off with the concept that 80% of healthcare these days is around chronic disease. So chronic disease is what drives us. And chronic disease is, the classic things like diabetes and hypertension and obesity. But it's also other things like depression or arthritis or anything, any health problem that's been in your life for more than a few weeks is considered chronic disease. So that's 80% of the healthcare dollar, 80% of the healthcare provider's time. And then if you look at those chronic diseases, 80% of those chronic diseases are directly related to lifestyle choices. What we eat, how active we are, how well we sleep, those kinds of things. And so there's this direct correlation. And then what we find is that if 80% of the chronic diseases are directly related to lifestyle medicine or lifestyle choices, if you get those lifestyle choices right, you actually don't have to have those diseases. So there's that prevention opportunity because get the lifestyle right and then you'll never get them. But then people like, and one of my early influences in the lifestyle medicine movement was someone by the name of Hans Diehl, who ran something called the CHIP program, the Coronary Health Improvement Program.
Right.
And he would bring people into these intensive programs, and he would see we would see disease reversal in those programs. And that had been done, as probably a lot of the audience knows, that had been done by Caldwell Esselstyn and Dean Ornish. And if you look at the classic recommendations for how a doctor should treat disease, whether it's high cholesterol, high blood pressure, diabetes, most of these chronic diseases, all of those classic recommendations start off by saying, diet and exercise. That's the thing you need to start off with. The issue is in medical school, we never get taught that, right? We get taught the medications and the procedures, not the diet and exercise place. Even though we know, it's in all the recommendations, that diet and exercise is how you should start off. So the bottom line is, we've learned through these pioneers that you can reverse disease, mainly in intensive programs. What the lifestyle medicine movement is doing is they're coming along and sort of saying, you don't have to only do it in an intensive program. If we give the skill set to every healthcare provider, then you can actually reverse disease in an outpatient setting, over time. There's still a place for those intensive programs, but we can do it by gradually changing our diet, gradually changing our exercise patterns, gradually changing how we manage our stress, and you can still get disease reversal. And there's data, and there's also so many great stories about that actually happening.
Yeah, and that's really important. Wayne, how can people, if they want to follow up with you and find out more and more about what you're doing, what's the location and the address that they can go to?
So what happened with me is I felt like the lifestyle medicine movement had the scientific data and it was on the right track, but it didn't have the economic data that it needed to really go forward. So I left academia 9 years ago now, and started my practice. My website is www.lifestylemedical.com. We have 2 clinic locations. They're both in the Inland Empire area of Southern California. So we're east of LA, north of San Diego. One clinic is in Riverside, and the other clinic is in Redlands. And you can get the exact addresses at that lifestylemedical.com website.
Has the lifestyle medical situation, the organization and what they're promoting, have they become, or are they strictly plant exclusive, or are they allowing for other small amounts of other things in the actual nutritional component? I'm just curious. I'm assuming that it is much more plant-based, but is it really plant exclusive?
It's plant-based, but not plant exclusive.
Okay.
What we say in sort of the discussions we have, well, I mean, we have to meet patients where they are. So a lot of people come in, and if you sort of went straight at, plant exclusive, some of our patients wouldn't be ready for that. We're a primary care practice, and we take all comers. We don't only have people who are there because of our lifestyle medicine component. But we sort of talk about being 95% of your calories being plant-based.
Right.
Obviously, some of us like to go to 100%. And interestingly, what I've noticed is for my sicker patients, those are the ones that I push harder towards 100%, because it does seem to make a difference.
Well, they've lost a little bit of leeway for error. That's the problem. Look, when you got yourself in a pretty good position and you're not really dealing with a real chronic illness, you've got a little leeway to make choices that may not be as rigorous. But obviously, when you're really dealing with full-blown pathology, sometimes you've lost a little bit of that leeway for error. So I understand that completely. In that adjustment or meeting people where they are, do you see a place for these faux vegan foods, things, and we all know that they're not as healthy as whole, plant foods, but they do, mimic, and Loma Linda has a long history of making products, there's of those kinds where you have, synthetic meats and so on that are vegan products, but they're a little higher in oils and salts and they're more processed. So do you see a place for that in helping people on this path to make that adjustment when they can't really go full commitment to whole food plant-based?
Yeah, well, it's, just a little story there. I grew up eating a lot of those faux vegan foods or faux meat products.
Right.
But if you came into my pantry right now, you wouldn't see any of them.
Right.
They're not there. So in our practice, we talk about Michael Pollan's mantra, which is eat food, not too much, mostly plants. And of course, eat food means you're eating whole food.
Right.
And so that's very important to us, and we do emphasize that. So we talk about whole food a lot, and obviously these fake meat kinds of products, they're not whole food. They're very processed. But we do feel like the coconut oil and some of those other things that are frequently in the fake meats, they're not great for us, but they're probably better than the fat that's in the bacon or the hamburger or whatever. Those are the things we push. But then the patients who say, oh, I just had a patient, I think it was yesterday, who was talking about the macaroni and cheese that they'd made with cashew cheese and other things. Well, in my books, that's not going to be that healthy of a meal. But I said nothing to that patient because I knew where that patient was, and I wanted to be supportive of where they were and help them along their journey. So sometimes I'm going to be supportive of those things. It's probably not where I want the patient to end up, but I'm going to be supportive.
I understand that, Dan. My philosophy through the years of handling people was to really, in a sense, teach them where they're at, not where I think they should absolutely be, because sometimes they're not quite ready to be at that place, and then you can turn them off to something that may really dramatically improve their life by being too rigorous in that direction. So I appreciate that approach, and I understand that. And I think we're all at a point where we realize the devastation of animal food production and processed food production on the planet and other creatures on this earth, so that anything that brings people into the fold, for me at this point, I kind of want to support. And once they're in the fold, we can get them to be a little bit more pointed and rigorous, so to speak.
I agree. Yeah, I agree. And I think the plant-based movement has actually recognized that as a whole at some level. So we talk about Meatless Monday. I mean, obviously, we wish it would be way more than Meatless Monday, but if that's the place to start, then we can start there. So I think this movement as a whole has sort of recognized, let's take it one step at a time. Let's meet people where they're at, and we'll keep moving them along. And if you look at the culture overall, I do believe that we are moving along as a culture more towards a plant-based world.
Well, there's no question. I've watched this over 40 to 50 years, so there's definitely a shift and a change. Take me through Lifestyle Medical, your approach and your practice. And so, do you integrate programs online with programs in person? Give the audience a little bit more of a bigger picture. If someone wants to get involved with you, how does that involvement look? Whether they're local to you or at a distance, how does that get integrated?
So we're a primary care practice. Our economics are based to a large extent actually on Medicare Advantage, we when we set up our practice, we said we didn't want to be paid fee for service. We didn't think we could do what we wanted to do in a fee for service environment. So we've sought out contracts that were capitated, meaning that we're paid on a monthly or an annual basis.
I see.
And the best capitated contracts right now are these Medicare contracts that are in the Medicare Advantage world. So we do a lot of that, but we also have private pay. So you can join us as a member, on a private pay, and we take a lot of insurances. There's a little membership fee on top of that.
Yeah. So so if someone is so you can take people local to the practice, but you can also, do you have programs that you share online then? Is that how that works too? Do you do any of that?
We do a lot online. Yes. Okay. Some of our, a lot of the stuff we do online is local patients who just prefer the online visit versus driving into the office.
I see. Okay.
We haven't pushed hard into anything nationally. We do see that might come in the future. But, obviously as a physician, to push hard nationally, you have to get your licenses right.
Yeah, so there's license restrictions.
Primarily a California.
Yeah, there's license restrictions, of course. Yeah, I get that.
Right.
So when someone comes to you, I gather that, like you said, there's nutritionists involved. You've got psychologists, people working with the stress component, I'm assuming, to some degree. You've got exercise support people to promote.
Yeah, we do. We have a nutritionist. We have a physical trainer. We have a social worker. and we have several health coaches. All of those are free to our practice. Another thing I should say is we have a lot of groups. We have meditation groups and
Cool.
support groups.
That's a big piece because I know one of your visions is to, help people to live functionally to that 90 to centenarian level, like we see in some of these blue zones. And as you and I know, one of the strong suits of those cultures, all of them, is that connectiveness, that idea that there's a socialization that is a strong support for people as they're going through their lives. And I gather with your program that you're kind of engendering that. You're engendering support groups.
Yeah,
And you're engendering a community sense within your practice.
In our practice, we have 4 pillars. One is nutrition. And we already talked about that. The second is movement. And so we try to support that. And because we have a lot of seniors, movement is so important to help keep people young. And then our third pillar is what we call resilience or renew. And that's focusing on sleep and stress and sort of how you manage your energy. And then our fourth pillar is actually connectedness. So we spend a lot of time trying to support our patients. And most patients have good social systems anyways,
Right.
but there are those who don't. And so we try to support that, and we try to create a lot of that connectedness even within our family, within our practice. We like to think of us as a family or a community within our practice.
So if a person hooks up with you or decides to come to you in terms of your practice, how are they exposed to those 4 pillars? How does that operate in a practical way? Give me an idea. I come to you and now we go over my history, you do an intake, you do whatever you do, and then you assess at that point what's necessary of those pillars first in that person's life, or how does it integrate? Give me a little background on how that happens.
Yeah, so before you even show up in the office, most of our patients are able to do an online intake that goes over those 4 pillars and the details of what each individual patient is doing in those 4 pillars. So that's step number 1. When you get into our office, you'll get what we call our lifestyle medicine vital signs, and it's asking people how they're doing on each of those 4 pillars.
I see.
We ask them how they're doing on each of those 4 pillars every visit, every patient, every visit. So it's like taking your blood pressure or your pulse. You have to answer those, and initially patients sort of wonder what it is, but after a while they just come in and it takes them 10 seconds to fill it out.
Right.
And then our electronic medical record is divided into those 4 pillars at some level as well. So it's something that we focus on there. We do annual updates on those 4 pillars. So there's a lot of different ways that we sort of incorporate those into our practice.
Wayne, are you gathering data? Is there a database that you're putting together from what you're seeing and working with in your practice that you're hoping to publish in terms of epidemiological data or anything in that regard? Are you doing any data collection and data gathering?
We do collect data, and we do have a published paper actually on the statistics from our practice.
Oh, that's great. Yeah.
And interestingly, we've decided to measure ourselves through something called the triple aim, which means that we're after improved patient satisfaction, we're after improved clinical outcomes, and we're also after improved cost. And we show we have usually around 90. There's something called the NPI score. We usually have around 90 on that. The typical primary care practice is around 3, so we have much higher patient satisfaction than average. On the clinical outcomes, we have data showing lowering hemoglobin A1Cs, lowering weight, lowering LDL cholesterol, and getting good outcomes while we're getting people off medication. So we can do a lot of medication reduction and medication removal. And then on the cost scale, it turns out this is less expensive care. And so we're saving compared to the average Medicare patient, our patients' costs are about 30 to 40% less than the average Medicare patient's costs. And again, that's published data that's available if you email me.
So just to be clear in my own mind, so when that person is involved in that Medicare Advantage program and they come to you, there is a fee that Medicare will cover for that 4-pillar approach basically per person, and that's how you operate within what they're willing to pay for that service?
Yeah, so I mean, this is maybe getting into too much detail, but Medicare puts aside about $12,000 per patient per year on
I
average.
see. Okay.
And we've actually over time been able to create contracts. So it's way more complicated than this, but basically we get those dollars ourselves, those $12,000. Again, it's way more complicated than that, but more or less we get those dollars.
More or less. That's all. We don't need
Right.
to.
And then we have to pay the hospital, we have to pay the specialist, we have to pay the radiologist, we have to pay those people. But then what's left over, we get to keep.
I got it.
So.
And that's a rewarding way to practice because you're doing what you want to do with lifestyle medicine. So where is it that you want to go, Wayne? What's the next step? Or is it just the development of where you are? Or do you have a vision of what else you'd like to do with all of this?
So when I was young, I had all these dreams, but now I'm a little older, and so I sort of say, well, it's one day at a time. But I will say this: I still have dreams, and my dream is that at some point, as someone chooses a physician, they can say, should I go to the lifestyle medicine physician or should I go to the old-fashioned allopathic reductionistic physician? And so I would love to see that happen at some point. And I have a dream that a physician, as they're going through medical school, can say, do I want to go the lifestyle medicine route, or do I want to stay in the old-fashioned allopathic reductionistic route? We're currently in Southern California. We did have some business people who learned about what we were doing and joined us, and they're helping us create larger visions about taking the model nationally. It's too early to know exactly where that's going to go, so I can't say very much right now, but there is the chance that this kind of model will become more available other places.
That's fantastic. Well, Wayne, as we wind this down, are there any final words you'd like to share with this audience? Any insights or words that you'd like to share out here?
Well, first off, thank you to you, Dr. Sabatino, for hosting this program, for bringing me on. It's been a privilege to be here. And, for the audience, you're part of the leading edge. You're part of the movement that's really making a difference. And we know our world needs changes. We know this chronic disease epidemic is something that's crazy and it's not even needed. So we have to change our world, individual by individual, family by family, community by community. That's what we're trying to do, and that's what you're doing in your life. And I'm just glad that we have these kind of forums where we can get together and encourage each other, because sometimes it's hard, right? Because we're going countercultural at some level, but we're doing the right thing, and the fact that the movement is growing shows that we're doing the right thing. And the fact that we can get the scientific outcomes and even the economic outcomes shows that we're doing the right thing. So we just need to be patient. We need to hang in there. We need to keep holding each other's hands, use ourselves as a community. And we'll get there. This is a worthwhile thing. For me, it's been the most gratifying thing I've done in my career, for sure.
Well, that's fantastic. And I think highlighting this as we end, this idea of cooperation and collaboration being the strong foundation for how we move this consciousness forward. I think that's really where it's at. And I think most people are recognizing that more and more. I really want to thank Dr. Dysinger for his time, energy, and efforts with us today, sharing his insight and his information. I urge you to follow him at Lifestyle Medical. You'll see that in the show notes. If you are interested in his program and what they're doing, you can get in touch with him and find out more about that through that site. And I urge you to follow him. I also want to really thank the audience that joined us today. We are very grateful to have you as an active part of this community, and we thank you for being part of this active health community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino. I want to thank you for joining us today, and I look forward to being with you again on the next episode of the Health Science Podcast. Thank you so much. You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.